So first of all, thank you so much for the opportunity to speak to you. As was said, my name is Kat Macaulay. I'm the Chief Design Officer in Scottish Government, which means that I lead the community of service designers, user researchers, interaction designers, content designers, and so on, who get involved in designing and delivering public services, all kinds of public services, but a lot of the work obviously around digital public services. And I'm particularly delighted to chat to you about this because it's a topic very close to my heart. And actually, it's probably something that all of us have a more familiarity with than we might think about. And so I'm going to try and sort of take us back, you know, George just did it as well, take us back to the start of the pandemic for a minute. For me, that was March 2020, when that really hit fully in my life, because that was the point at which Scotland went into lockdown. And for those of you in countries who went into lockdown, that may be at slightly different points. But nevertheless, if you can just cast your mind back to that day when you first really realized, wow, this is it. My life is changing completely. I'm going to be largely based at home. And the bulk of my life will be lived out in a very different way and in a very different environment. For me, that moment was particularly powerful because I have an underlying health condition, multiple sclerosis, that meant I was particularly vulnerable to COVID, and so was going to have to take that lockdown even more seriously than perhaps my family and others around me might need to do. So think back to those days, think back to that moment when you're at home and realizing that your work, your personal life, your social life, your fun, your leisure, your entertainment, your shopping and your healthcare were all going to be things that largely had to be managed, accessed from home. For most of us, that was a bit of a shock, but we all turned immediately to the plethora of digital devices and tools and technologies that we have around us that would allow us to manage that moment. And I'd like you to now maybe just spend a minute thinking to those early days of the pandemic and thinking about your digital life then. How many devices did you have in your home that allowed you to access the digital world? How many tools and applications did you use in all aspects of your life that helped you get through those early days of the pandemic, and sadly, all these many months later continue to do so? For me, at that time, I live in a household with 2 adults, 2 children and a dog. And I actually counted it up at that moment. I thought to myself, oh, wow, we have 21 devices of various kinds, mobile phones, laptop computers, desktop computers, smart TVs, consoles, smartwatches, a whole bunch of them in the house, 21 digital devices, which kind of shocked me as well initially. And we had a huge range of digital applications and services that we used as well in conjunction with those devices. And when I thought to myself, I realized that I had 3 devices that I used daily, multiple times a day, literally from the moment I got up to the moment I went to bed. Some of them were actually helping me out while I was asleep as well. And I had another couple of devices that I would use, not perhaps every day, but certainly multiple times a week. And I had around 12 to 15 applications and digital services that, again, I would use multiple times a day or certainly multiple times a week. And at that moment, I realized just how deeply digital I am. So I'd like you to maybe just take a minute while we're talking to think back to that time yourself and try and count up how many devices were in your household at that point. How many applications and services do you think you were using that helped you get through the pandemic? And actually, it'd be really interesting if you can get your mind back to that time and do that work, just to stick those numbers in the chat, just so we can get a sense of what other people's lives are like. But I think the thing that really hit me at that point was that we are so deeply digital, we forget that. Certainly for folks of my generation, the idea of digital and computing still feels a bit new, a bit unusual, a bit special. And if somebody had said to me, are you a digital expert? I probably wouldn't have said yes. But actually, when I think about it, my familiarity with multiple devices, multiple applications, multiple services and tools and the ways in which I use those in different combinations for different parts of my life all day, every day, is incredible. Especially, again, for those of you who are roughly my age, to think back to the time before all of that, when, you know, digital wasn't in our homes, it wasn't in our schools, it wasn't even in our workplaces particularly. So for me, and for many of us, getting through the early days of those pandemic was made enormously easier by the presence of the digital world in our lives and by our deeply digital nature, by the fact that most of us, whether we know it or not, would recognize it or not, are digitally pretty expert. But what occurred to us in those very early days, as we started to look at how we were going to protect the people who were most clinically vulnerable to COVID, and started to think about what we did in Scotland, for example, which was a shielding program where, you know, large numbers of people were asked to not just to stay at home in the way that the rest of us were being asked to stay at home, but to really stay at home, was that many of those people, you know, the reason that they're doing that is that they have significant health challenges. And for many of those folks, a significant health challenge often goes hand in hand with poverty and low income. And we know that at that point in Scotland, around 300,000 people were essentially completely offline. Most of those due to poverty, some through choice, but most due to poverty or low income. They just couldn't afford the kinds of costs associated with digital devices and digital services and access to data and so on that the rest of us can. And I think the pandemic, more than anything else, really drove home to us the difference between how we thought previously around digital exclusion, which was it's a thing. We know some people can't or won't use digital tools and technologies, but it's kind of a nice to have in life, so it's not essential. And all of a sudden we were faced with very large numbers of people. Scotland only has less than 6 million people in the population, so 300,000 out of 6 million is a pretty big number. We had a significant number of people who were going to really struggle during the pandemic due to that lack of digital access. And not only that was going to be a problem for us too. If we couldn't reach those people to provide the kinds of digital healthcare that all of you have seen such a huge growth in during the pandemic, if we couldn't use digital to find out where they are, check in with them, make sure they had the correct information, make sure that they could get the shopping they needed so that they didn't starve to death in their homes, that all of those things were going to be so much harder for those people that weren't online. So it was really the first time, I think, as a government, certainly, and possibly for many of us in the country as citizens, we really started to think about what would life be like if you're not digital? And is it really feasible to have large numbers of people offline in this day and age? Again, if I think of my life, I still talk about the digital world as if it's something different to everyday life. My children would not recognize that. The idea that the virtual world is somehow substantially separate from and different to the rest of life, it just doesn't make sense to them in the way that it perhaps does to me. So as we faced into this, as we saw this problem emerging, we realized that we were going to have to step up and do something about the problem of the folks who, in our country, who through poverty or low income are unable to access digital services and the digital world. And so we set up and launched in the teeth of the pandemic a program called Connecting Scotland, which works with local authorities and third sector, voluntary sector organisations in Scotland to identify digitally excluded or heavily digitally marginalised, and I'll come back to that in a second, folks in the community who were at sort of clinical risk, additional clinical risk during the pandemic. And since that moment, we've brought 60,000 nearly households online. I think we're thinking, well, we'll be 60,000 by the end of this year. We're around 57,000, I think, at the moment. Those are people who've been identified as digitally excluded on low incomes and fitting into some of the criteria that were being, of the groups of the population that were being particularly affected by the effects of the pandemic. They get a device, and due to the time we were trying to do this in and all the challenges around the supply chain and devices and so on, that was limited to either a Chromebook or an iPad. They get 2 years of free unlimited data. We did that through a MiFi. We couldn't obviously go in and start connecting up large numbers of people to broadband during the early days of the pandemic, so we chose to use small MiFi devices for that purpose. And they also got access to training and support to help them make use of all of that. And that program, as I said, has been hugely successful. Enormous numbers of people have been brought into the digital world in a sustainable way for the first time. And I think one of the things that we've learned from those people, from the customers of that program, is that the dimensions of digital inclusion are more complicated than we had imagined. I mentioned digital marginalization earlier. That's a particular problem for families where they do have access to the internet, but that internet access is through usually a single device and not particularly smartphone most commonly. They have very limited data in terms of speeds and bandwidth. Their access to the internet has to be sort of managed very carefully. If they're on things like certain benefits, they often have to use a lot of that small amount of data that they have to meet the requirements of receiving the benefits, for example. Before the pandemic, they would have perhaps used resources in the community, booking some time on a desktop in a library, for example. Perhaps some of them who are on low incomes but not unemployed, and that is a problem that we deal with in Scotland, would have had some access at work, but actually what we discovered is that typically people who are working on low incomes and can't afford digital access for their families are also working in the kind of jobs where they don't really have much access to digital. We've also discovered that there are a lot of issues around households where you're sharing a device amongst people. Some children, for example, in low-income families will get access to a device for doing work through school. However, they aren't able to share that device with other members of the family. And that can be a problem if you think about, if you've got children in your family, how as parents you're often providing additional digital support to your children as they use those tools and technologies. Or in my case, when your children are older, the roles are reversed. Now they're the ones that provide me with the digital support. So we've got a problem that we are starting to tackle in Scotland with a large and very concentrated push on the challenge of bringing more and more people into the digital world. And I think for this event and for you, the kind of question, and for me actually as a designer of public services, the kinds of questions that raises are, is it enough for us to continue to think of this problem as a sort of problem that doesn't affect a huge number of people, and that our kind of default answer is typically assisted digital in our language? You know, that I'm quite sure that most of you will consider the challenge of designing digital services, e-health services, that will be used by large numbers of people, some of whom won't have much access to digital or any. And what we typically do in those circumstances is we tend to think about the concept of, well, we'll find a workaround for them. And I think what the pandemic really taught us was that that's not going to be enough in the future. As our lives become ever more deeply digital, and as those of us who are lucky enough to be able to afford the access to the digital world, embed that digital world ever more deeply in all aspects of our lives and become more and more familiar with multiple tools and multiple services, and they're becoming more and more expert without even really realizing it in fully exploiting the digital world for our own benefit. The gap between us and those who can't afford to be online will become dangerously wide. So is it enough for us as designers of these services only to think about providing a workaround, usually in the form of, well, someone else can do it for you, for those folks who are digitally excluded? Or do we all really need to start thinking about the root cause of that problem? The fact that those people are offline itself is no longer something we can continue to ignore. So how can we make sure that as we develop our public services, our health services, and really start to exploit the benefits of digital, that we really start to think about the problem of digital exclusion as something that's also our duty to really attend to? Is it okay to design e-health services and just assume that some people won't be able to use them and they'll need someone else to do it for them? Or shouldn't we be trying to think as citizens, as services, and as countries about how we make sure that no one gets left behind in the digital world? Because I don't think most of us fully understand, when you think about not just full digital exclusion, but also digital marginalization, how big a problem that is for people. And what we really need to be thinking about is, what's it going to take to ensure that we don't leave anyone behind because we've brought them over into the digital world. And I'll leave with just one little thought, which is, again, one of the insights we got from running Connecting Scotland over the last year or so, is that this issue doesn't just affect people who are unemployed. And in fact, it affects quite a lot of people who work in health and social care, because many of them are in the kinds of low-paid jobs that don't involve regular use of digital. So they're not building up digital skills and digital familiarity at work, and they don't have access to that at home. So again, their opportunity to become as deeply digital as the rest of us is very limited. So let's make sure that we're thinking about this as we go through the rest of the event, but also I think I would be really delighted to hear more from people on this call about some of the efforts that are going on in places that you know and places that you work around how we understand and better address the challenge of ensuring that no one gets left behind in a digital world. Thank you.